Hello everyone, my name is Jenny Rios and this is going to be my final SEL video reflection. This is for APN 756, Applied Nutrition Capstone, and this is for the University of New England. So for my SEL reflection, I'm going to talk about my experience in the community side. Um, this community site is called Center of Health Promotion, which is hospital program that help all patients improve their diets and overall nutrition health. And during my last rotation, I had the opportunity to assess patients with variety of conditions. Some of the consultation focus on weight management, chronic kidney disease, which it was surprising because most of those patients we had at the site. We also see polyendocrine metabolic ovarian syndrome, PMOS, cancer, and how people need to manage or control diabetes. We also have those type of patients. And I remember that I connect with one of my patients in particular. She had a 7 months old baby and was diagnosed with polycystic ovary syndrome, PCOS. And she was struggling with her weight management. And I shared with her that I also had a 4 months old baby and I have PCOS too. So I understand how challenging it can be to lose or gain weight while living with this condition, especially during postpartum period. I know how hard it is to do everything right and you know how to spend time with the baby, your things, weight, and all the stuff. So during the consultation, I provide educational materials and explain to the patient the type of diet that is more appropriate to manage PCOS or PMOS without compromising lactation because she was lactating her baby. So I told her that we have to establish a realistic goal of consuming calories based on her estimate metabolic needs, plus the additional calories required for breastfeeding, because breastfeeding right now, it was the most important. And we agreed to focus on maintaining her health and supporting breastfeeding with the plan to begin a structured weight loss program after her baby turned 1 year old, or she just want to stop breastfeeding her. Um, a few weeks later, because most consults we follow up after 1 month, so she returned for a follow-up visit and she was actually really happy to report positive change. She had been following the recommendations, how much calories needs to eat and feel more energetic, notice some weight improvement and had incorporated regular walkings in her routine. She shared that she felt motivated and encouraged by her progress. This patient has a significant impact on me because it reinforces the importance of building a strong connection with patients. When patients feel understood and supported by the dietitians, I think they are more motivated to follow through their goals and making positive lifetime change and more achievable than others than just give their regular recommendation and don't do any type of connection with the patients. So answering these questions, at the Center for Health Promotion, CHP, there were a total of 3 staff members. The first was the registered dietitian with I was working closely with her. The second was a nurse who was responsible for providing diabetes education classes to members of the community, focusing on diabetes management and self-care. These kind of classes, she advised them like what kind of food or what was the portions that the patients needs to consume, and also they teach them how to take the glucose in the monitors. And the third person in the team member was the program coordinator who managed patient appointments, scheduling, and some meetings. The coordinator and the dietitian work closely as a team because whenever a patient cancel or reschedule an appointment, the coordinator communicate the changes to the dietitian so she could adjust her consultation schedule accordingly. This collaboration helped to ensure efficient patient care and allow to the clinic to make the best use of available appointments times. Also, when people cancel the appointments, and if we had like a consult with the patient with a lot of questions and all the stuff, so we can just prolong a little bit our consults because consults only last 30 minutes. So sometimes it helps to extend a little bit the consultations. Okay, to answer the last two questions, I think, to be honest, at first I found it difficult to be open with the patients because it's way different than the hospital. Because in the hospital, you just grab all the information that you need, and that's it. And with these patients, they share like a personal stuff, and it's more like a you know more about their lives, and you just have to be like really professional and um, recommend the most appropriate advice, nutritional, and even if you can support them in some way, you can do it. However, my preceptor explained that patients often feel more comfortable and engaged when they can connect with their dietitians, and that's what happened with the example that I did before. I gave before. So I think uh, if you can have something in common with the patient, it will help you. And also to the patients, it will help them to build trust and strengthen the therapeutic relationship. And what else? Ah, what community nutrition issue would you like to address in the future? So to be honest, I had an autistic kid. Her mom bring him because she was worried about what he was eating. He had problems with what type of food he wants. He only eats potatoes, and I didn't have idea how to help her because I don't have any like a background or experience to with autistics. So my preceptor gave her some advice, and I think it will be beneficial to learn more about nutrition among autistic people, learn what techniques we can give for a better nutrition, how we can help them, because I think people with autism are more common than before. So I think it will help a lot if we want to do like a community um, jobs. And that be it for my presentation. I hope you like it. Thank you.